Hello and a very warm welcome to this King's Fund online event. My name is Michael West. I'm a visiting fellow here at the King's Fund and Professor of Organisational Psychology at Lancaster University, and truly a very warm welcome to all of you joining us for this online event. I have the privilege of having a conversation which you're involved in, and a privilege of having a conversation with three really wise and very experienced people who I'm sure are going to inspire you over the course of the next hour. So initially we'll make some introductions of these amazing people who I'm here with, and we'll say a few words about the core issues to do with compassionate and inclusive leadership. And then we'll have a conversation around some of the questions that we think are really important to address. And then you're invited to submit questions for us to address during this time. And you'll see at the bottom of your browser a little box where you can write those questions in. And because there are, I think, about 2,500 of you who've registered, we may not get to them all, but we'll do our best to pick up the key themes that emerge. And you can tweet. It's hashtag KFOnline. And I'm delighted now to introduce our three guests. First, Priyana, if you could introduce yourself.
Thank you, Michael. Really a pleasure to be here. And thank you for your kind words. Wise and experienced. I'm not sure my teenage son would agree with that assessment. But yes, thank you. And really pleased to be here. I have just joined recently as the Chief People Officer for the NHS. I will be honest and say I'm still working out what that means. This is week 5.5. And prior to this, I worked at the United Nations in the humanitarian world. And prior to that, 15 years at Unilever.
So enormously experienced, and I always think, that when people first join an organisation, they probably have the sharpest, truest perceptions of what the culture is like, because they haven't yet been marinated in it. And so I guess I'm really interested to ask you, what are the one or two things that have really surprised you about the NHS? I'll
say two things. One is, it's kind of degrees of surprise. Coming in, I knew that it's a very complex job at every level. Whether you're a porter in a hospital or chief exec of a mental health trust, these are very important and very difficult jobs. I knew that conceptually, and as someone who's used the service. But coming in and just in 5 short weeks, just the scale of that complexity of the service that has to be delivered and under what conditions, that's just staggering. So it gives me, a huge amount of even higher respect and also a lot of inspiration, because the second thing that surprised me was just how many incredible people there are. And everybody I meet is just so passionate, so insightful, and so committed to what they do, and keep the patient in the center of everything they are striving for. Is just quite inspiring. Well, let me add a third. And that is a segue into this topic, because what I'm trying to understand is what lies underneath the, let's say, lack of compassionate leadership. Why do we not have more of it? And so I've been asking some questions, and what I was surprised by is that sometimes the primacy of the patient, right as it is causing people to sacrifice their own well-being and the well-being of their colleagues. And that's surprised me, but I mean, not entirely, but just the fact that there seems to be this choice, whereas both of those things go hand in hand. Those are the three things.
Yeah. So the complexity and the fact that those who work in the NHS are people with such inspirational motivations, and also the need to address how we look after them so that they can do the job they want to do. Thank you very much, Priyana. And next is Sam Allen, who is Chief Executive of Sussex Partnership Trust, which is rated good from the CQC and outstanding for patient care.
That's right. We're a mental health and learning disability organisation down in the southeast of England. It's a real privilege to work in the NHS. It's a huge privilege to be a chief executive of an organisation like Sussex Partnership, and it's an organisation and full of colleagues and people who use services, families and carers that I'm hugely proud of.
And so you've had a lot of experience of leadership, Sam, and I guess what I'm fascinated by is when you have people who are just starting out on their leadership journey, what are the kind of pieces of advice, one or two pieces of advice that you feel are really important for getting leadership right?
Yeah, and I'm still learning, so learning every day, and I suppose that would be my number one piece of advice. I think secondly, I do mentor a lot of women, women leaders, and my sort of key message to them always is don't strive for perfection, and don't let your fear hold you back from doing things. I think though, most importantly, I would say to leaders out there, really get underneath what your leadership stands for. It took me a long time actually through my career so far in the NHS to really stop and think, what does my leadership stand for? I'm clear about that now. It's about being in service to others, but it wasn't something I was always clear about, or I didn't think intently about in terms of my leadership behaviours and actions. So I would encourage all leaders out there to take some time to talk to colleagues, to take some space for themselves and just think about their leadership and how they want to apply that in the context of their work.
So in leadership in service of others, compassionate leadership in effect. Wonderful, thank you. Don Berwick.
Thanks, Michael. Yeah, I'm Don Berwick. I'm a pediatrician. I'm currently President Emeritus and Senior Fellow at the Institute for Healthcare Improvement, IHI, which is a nonprofit organization that I started and led for 20 years in Boston, Massachusetts. It's global in its scale, and I'm here as an international visiting fellow at the King's Fund, which I've been doing for about 5 years now, off and on, with the help of NHS England and NHS Improvement. And
you've had an enormous, genuinely had an enormous impact around the world on healthcare systems. And I guess my question is, on behalf of those who are watching this, is you've experienced many healthcare systems and healthcare organizations around the world. Are there one or two you would immediately kind of identify as being outstanding in terms of compassion and inclusiveness?
Well, I sort of agree with what Prana and Sam said. You find it everywhere, so it's actually hard to think of a specific case because I can go to yesterday's visit. To a couple that occur to me that I would underline. I had the privilege of meeting Rob Webster, who's the CEO of the new integrated health system in West Yorkshire and Harrogate, here at the King's Fund, and then I visited there. It really extraordinary ethos. I'm sure they would be the first to say they're not everything they want to be, but they produced a document which everybody in the NHS should read. It's a kind of it's a prospectus of what they're going to become, and on practically the first page is a sort of promise, like, well, we're going to promise this to the people we help and serve, and you can't read it without being inspired. It's a list of these wonderful offers to the public and partnership. To work there with that as your charter would be so meaningful, and you can feel it there. It's this sense of meaning in work. Another that I deeply admire is Cincinnati Children's Hospital Medical Center in the United States. Cincinnati Children's Hospital Medical Center has been leading in really deep person-centeredness, in which the voice of the people being served is present all the time in the place, and you get this sense of, again, meaning and connection that I think everybody who works there must. I remember visiting there on a grant review visit, in which we walked in the room, and there was the chairman of the board and the chief of everything and the CEO, but the first speaker was the mother of a child with cystic fibrosis. They put the person first, and I think it gives real meaning to what people do, and that's the secret.
So two really great examples of where we can get inspiration. Thank you very much. See, I told you they were wise and experienced. So we're talking today about compassionate and inclusive leadership, and the reality we face is that around the world there are huge workforce problems in healthcare. We also see in our own system high levels of stress among staff. 50% more staff in the NHS report debilitating levels of work stress compared with the general working population as a whole. And we know that has an impact on their health and well-being, and it is an issue we must address. And we also know that we created a healthcare system back in 1948 to be compassionate, providing high quality, compassionate and continually improving care, and we created a health service that was designed to be inclusive, not to exclude anybody. And I think those two values of compassion and inclusion are fundamental to our health service. We know that when patients experience compassionate care, care outcomes are better, and we know that when staff are able to be compassionate, that has an impact on their motivation and well-being as well. We know that if we have inclusive leadership in healthcare in England in the NHS, that's associated with much lower levels of bullying and aggression and discrimination and harassment. And we know that where healthcare staff are representative of the communities that they serve, that is associated with significantly higher levels of care quality and better financial performance. So inclusiveness and compassion are fundamental to our health service, and it's about how we create those cultures. And culture, of course, is a consequence of each of our interactions in our organisations every day, how warm we are, how kind we are, how irritable we are, how cynical we are, how compassionate we are. But the role of leaders is particularly powerful, because what leaders pay attention to, what they talk about, what they monitor, what they reward, and most importantly, what they model in their own behaviour, tells us what the values of the organisation are, therefore the culture. So this topic of compassionate and inclusive leadership is fundamental to the delivery of our health services. So I encourage you to think of questions that you would like to ask, take advantage of this opportunity, but I'm going to begin by asking these wonderful people a few opening questions. One of the puzzles for me is we have so much evidence about why compassionate and inclusive leadership is so important in terms of our healthcare systems. Why don't we do it? What gets in the way? Sam, would you like to begin?
I mean, there are quite a few things. Life in general sometimes. I think when I'm talking to people joining the NHS now, I often say you'll probably potentially spend more time with your colleagues than you will with your family. And yet when people come to work, how do we create environments where they can be their true and authentic self and recognise their caring responsibilities and the stresses and the strains that go with life in general? None of us are perfect. I suppose if I was to think about three areas, Michael, the first one I think is a growing problem, actually, is this sense of justice and fairness and the need to blame people when things go wrong, whether that's in an organisation, whether that's in a system, or whether that's through the media. But this spotlight going on individuals when we are humans, and the one thing we know about us as humans is we will make mistakes. Sometimes in healthcare that is sadly very costly and incredibly tragic. But for me, it's about how do we put the lens on the learning, the fairness and the sharing. And there's a discourse for me, I think, particularly in the NHS at the current point in time, where the culture is not necessarily aligned. So our espoused values of candour and openness don't always match the behaviours that people experience, whether that's from colleagues or whether that's from the wider system. So I think
creating a sense of psychological safety for people.
Absolutely. Yeah. So for me, that's the first challenge. The second one, I'd probably do a more practical one, really. I think we've invested a lot of money in leadership development and developing leaders. I think we need to pay more attention to people management. So the skills that are needed to lead a team effectively, the skills that are needed to shape a culture in a team. We are all leaders, we all have that responsibility and we all have that ability. So for me, it's not just about the focus through the lens of leadership, but actually people management. And I think some of the low-level bullying and harassment that people experience, or the perception of it, is sometimes just by getting some really simple things wrong, that if we did better,
Poor people management.
poor people
in effect,
management, that we would avoid. And then I suppose the third area for me is around stigma and discrimination. So it's Mental Health Awareness Week. I work in a mental health organisation. It's fantastic we're talking about mental health, yet we still know that not everybody can be open about that. And then when we look at disability, we look at race, we look at gender, I don't believe we have a fair workplace at the moment. There are many injustices, and I was just reading just this morning actually about a GP who's lived and worked in the UK for 10 years, from India, who is expected to pay several £1,000s a year for their work visa. So on the one hand, we're saying we want you, and on the other hand, we're saying, but actually you've got to pay for the privilege to be here. And so for me, it's the discourse between our espoused values and the lived behaviours, and how we can get greater alignment of those.
So 46% of our doctors are from a BME background, but I think only around barely 20% are medical directors. So, and interestingly, if you look
only
at...
30% of those are female as well. Yeah.
And if you look at what predicts patient satisfaction, number one is workload, number two is equal opportunities, number three is discrimination, number four is team working. Prerna, would you like to add to what Sam has said about these obstacles?
Barriers to inclusive and compassionate leadership.
Yeah.
And I'll add, I agree with, I think, having spent my career in HR, people management skills is absolutely key. And let me add this, the heroic model of leadership that has been, through myth and legend for 2,000 years probably, has been the predominant model for leading anything. Is it, leading any kind of enterprise or military or even social change? The model has been heroic leadership. And you can't be a hero if you are also human and imperfect and vulnerable sometimes. And when we have people who are not really comfortable or allowed, or a mixture of both, to bring their whole self to work and always be a hero, then you really can't be compassionate, because first of all, you're not being compassionate to yourself. And in my life as a human being, let alone a professional, that's something I have grown into. It's not something that I learned or was even taught, in life, is how to be compassionate to yourself, and I'm still learning. And that I find I can see my own level of compassion to others when I'm compassionate and switched on into what's happening inside of me. And so when we are trying to be somebody at work that's always in control and has all the answers and is a hero, it's very hard to be inclusive and compassionate. It also sets you apart from everybody else. And then the other barrier, which I mentioned briefly in my introduction, which is about how some leaders feel that performance and compassionate leadership somehow are mutually exclusive. So either you drive performance or you drive compassionate leadership. And actually, you can't have one without the other. But I've had people ask me in the last few days, how can we do that? How can we drive performance and be compassionate? Compassionate is soft and fluffy stuff. And that means we lose our edge on performance. And so I see part of the work that we all have to undertake, really bringing those two things together and saying, actually, one leads to the other. So yeah, that's what I would...
In the absence of compassion, we don't get great performance.
Yeah.
Great, thank you, Don.
I agree with all of the above, though, in wise words. I guess partly what I notice is the compassion gets chilled when productivity becomes dominant as the aim. It's actually a misunderstanding of what the nature of productivity is. You can't have what my colleagues are talking about without relationships. And relationships, they're organic, they take time. And when we're in the transaction world, we're counting everything and metrics and pace and tempo. You don't have the time to fall in love. You don't have time to learn who we are. And I guess I wish we could decrease a bit our investment in transactions and more in the building of relationships. And the tempo is different.
And the irony is, when you look at the last 60 years of research on leadership, and that comparison of task-centered leadership and relationship-centered leadership, the evidence is clearly in favor of relationship-centered leadership. It's paradoxical that we don't learn from the evidence. It's about evidence-based approaches.
It must be harder. I mean, your question, why don't we? Maybe it's relationships are just more difficult, but their payoff is incomparably larger.
So let me turn to the issue of inclusivity and discrimination. We have made some good progress in our health service as a result of the inspiration and hard work of many people to try to address discrimination, particularly in relation to BME staff. So we see some progress on representation of BME staff at senior levels, and we're addressing some of the disciplinary processes, but we're not making enough progress in terms of the experience of day-to-day discrimination of people. And it seems to me the health service is the place that we should be getting this right in society above all else. And this is a tough question, but do you have thoughts on really what we need to do now to begin to shift that dial? Pren, I'm going to come to you first because you have this amazing new position of Chief People Officer, and this, I guess, must be a fundamental issue for you.
It's a privilege to be in the role of Chief People Officer, because I see part of that role very strongly being one of advocacy, and advocacy for everyone who's in the service, but especially for those who are a little bit on the periphery, and a lived experience of that. And actually from very early on, because my parents had a interreligious marriage in India in the 60s, and that was exclusionary. So our family was very different and excluded. So from a very early age, lived experience of exclusion, and then moving to and several points in life. If you're an outspoken woman, you get that, and then moving here. The first year that I moved from India to the UK, I was in a team and I was undermined and excluded and bullied, but I didn't know it was happening. I didn't have words to describe it. And I almost quit. It really knocked me for a long while. And actually even now I can feel my voice, shaking a little bit, because it still remains a very painful experience. And what I realized was I didn't even know what was going on. And so therefore one of the things I think we should do is to talk about it a lot more, to help people describe it. I have words for it now, but I didn't have words for it when I was going through it as a young person coming into a different setting. So how do we make space to talk about it? How do we have a sense of urgency about it? Because, we can't take another 50 years to make a real dent in this change. I don't even want to call it change. It's just it's the wrong thing that we're doing at the moment that's happening, and people's lived experience there's a lot of pain there, and how can we make space for that and really hear it? Because I believe if you hear it, if someone hears that pain, you're changed. You cannot go back to behaving or leading or managing in a way that you were before you heard that story and that pain. So we just need more space, and we need people who have something to share to also feel safe to share it.
That's really powerful. So thank you for sharing that. And from the research evidence, we know that when people are excluded, when human beings are excluded in any way, it has a powerful effect on their health and well-being. Belonging is the most important need we have. We're more likely to die from loneliness and exclusion than we are from smoking or other factors. So it's kind of fundamental. Don?
Yeah. First of all, as an American, I feel a little embarrassed to be talking about inclusion at this point. We have a monster in the White House, and our country's off track. I had a lovely driver yesterday, chatting with him, and I said, "Have you been to the U.S.?" He said, "I'd love to come, but I can't right now. My name is Mohammed," and I apologize. But the goals they're unmet even here. I think maybe share thoughts about this, but I think it partly has to do with openness and vulnerability. At the leadership level, everything you've said I agree with, but at the leadership level, you have to be open yourself. There has to be a leadership behavior and style which is in its nature inclusive. Make yourself vulnerable and demonstrate through your own receptivity how much you value everyone.
Yeah.
It doesn't solve it because there are process issues here. We've got to find people who are being excluded and bring them in, and there have to be processes for that. But there is a behavioral side to this among leaders, I think, also.
And there's something about in every team, every leader taking responsibility for creating a climate of inclusivity where diversity of whatever form, people disagreeing, diversity of professional background, but particularly diversity in terms of ethnic background, is seen as positively valuable for the team and how it functions.
It begins with what a colleague of mine calls authentic curiosity. The leader has to be really curious, about otherness, and I think that's important.
Yeah.
I just absolutely echo all of that. I had the real privilege recently of attending the RES conference that Yvonne Coghill arranged, and Professor Williams came over to present from Harvard. And what always shocks me, I suppose, is that the data's there, it is stark, not just in terms of people's lived experience, but the impact on health outcomes, on patient outcomes. And we know we've got a bit of a workforce crisis with 100,000 vacancies in the NHS. Yet when I go out, I see talent, I see optimism, I see leaders coming through the Leadership Academy Ready Now programme, desperate to get into these roles, yet applying 3, 4, 5 times to the same jobs, not getting feedback to support them, but also just not getting that opportunity. So I feel that we're at a bit of a tipping point, really, and I suppose I say that in my role as chair of the Women Leaders Network. And we recently sent our report on men as allies out to all NHS trust chairs and chief executives, and thinking about shaping culture is what the leaders pay attention to. And we know when it comes to women as leaders that actually if you engage the men, you're far more likely to succeed. So I think we need to get out of our silos. I think we need to look at inclusivity across the board. But it's an exciting time, but it's also quite scary because when you start talking to people about their experiences, it is painful, it's ugly, and there's almost the desire sometimes as a leader not to want to hear that. It's uncomfortable, it's deeply, deeply uncomfortable. So for me, culture is about what we pay attention to as leaders. I haven't seen anywhere that's got this cracked, but we've got the real potential not just to enhance people's working lives, but to positively impact patient outcomes.
So compassionate leadership
Absolutely.
and inclusive leadership is actually about being courageous and addressing the really difficult issues. And I agree with you. I think we are at a tipping point. There's no going back. So we must address this issue now and stop talking about it and identifying the problem and move to making a difference. I think that's absolutely right. So let's go to some of these amazing questions that you've sent in. So we have a question here from Efua Hagan at King's College Hospital Foundation Trust, who, you say that there's an issue with hierarchy within our NHS. There's so much hierarchy, and how do we break this down so that people talk about I'm a band 7 or a band 8 or a band 4 or a band 3? How do we break down hierarchy in order to create the space for compassion? And I think this is a really important question because hierarchy in the NHS does seem to stifle innovation. It stifles people's engagement because they feel disempowered. Don, you've seen lots of healthcare systems around the world and the problems of hierarchy.
Again, leadership behavior is where it starts.
Yeah.
I believe the leader, humility in a leader models the rest. I think the two other things I would say I've noticed. One is when the patient is in the room, when the people we're helping are helping us help, and their voices are present and powerful. This tends to break down this problem because they don't tolerate it. They're not interested in our heraldry. They're interested in getting some help. So I'd say get the community in the room and listen to what they are telling you, and they'll level things. And the other is that there is a skill base. We know this in other industries. For example, the plane I fly here from the U.S. is extremely safe. It's parts per 10 million safe. And part of that is because the crew know how to listen to each other. So if the lowest status person in the cockpit notices something, they are trained to speak up. And the highest status person is trained to shut up and listen. And that's not necessarily inborn. It has to be trained. And I think there's an educational part to this where the young professionals who are developing need help and coaching to learn to listen and honor the knowledge and the goodwill that's present everywhere.
I love that. I love that. Phrase. For me, it should be the first phrase in leadership training. Shut up and listen. The most important skill of leaders is to listen, and the most important task is to help those we lead. I think that's really.
You're honoring knowledge, and who knows where that knowledge may be.
Yeah.
I mean, I would absolutely agree. I think it drives me to frustration sometimes, particularly when I hear colleagues say that they'll have gone on a conference, they've gone to a learning opportunity, and one of the first questions they'll get is, what band are you? As if we're defined by our bands and our pay scales. So I think for me the change has to come from within, it has to come from all of us. I'd personally like to banish egos across the NHS. I have no time for them, and I don't think they have any place in healthcare as joyful as they can be at times. So for me, certainly in teams, certainly the team that we've developed down at Sussex Partnership and across our system is very much around treating each other as equals, getting to know one another, seeking out our knowledge and our experience. And then I would just finish by saying the small things really matter. So I look back in my career and I remember times walking up a flight of stairs or down a corridor and the senior leader coming towards me would not give me eye contact, would not say hello. So saying hello is really, really important. Stopping for people is really, really important, and getting alongside people is hugely important.
And the most frequent complaint I hear from NHS staff is, apart from patients and service users, no one ever says thank you to us. And I think it's because we consistently underestimate, as a species, how powerful saying thank you and appreciating people is on their well-being. Thank you. Prerna.
So when you were reading out the question, Michael, I was thinking of my son and my daughter, son almost 16, daughter 12 and a half. They won't stand for hierarchy, and not neither will your teenage son and your kids. So I think one of the answers to changing hierarchy is going to be the future, and actually the present generations, who are growing up in such a networked world, the democracy of social media, well, the tyranny as well, but that's a different webinar, the democracy of social media, and they are not going to stand for that. So they will both be a cause of our change, because we won't be able to attract people if we work in this way. They will not work, and in the private sector, we already see that change happening. I want to work in a meaningful place. Well, this has meaning in spades, but in a way that respects my personhood and my skills and my opinion. And that will change. It will both be the cause and the result, as more and more people who have grown up in this very really, I think I don't underestimate the impact of being able to share your view as a 14-year-old on Instagram, and then coming to work in a place where you're supposed to zip it and not speak up. That just won't happen. So I think that's the way out and the cause. And then for today, let's say, I've seen, I spent some time in Leeds, at the Leeds Hospital, and then at Wigan with Andrew Foster and Julian Hartley, both fantastic leaders. And I saw them doing what Don and Sam are talking about, really leading by example, and going into, Andrew went into the control room and just spoke to the wonderful lady who was managing beds, and just spoke to her and said, so what's going on? How can I help you? And that is, really smashing hierarchy, because there must be at least 10 bands between the two, and it didn't matter to him, and it didn't matter to her. It was wonderful.
And that's what leadership is asking the question, how can I help? So I think, the most important skill is listening. The most important task is helping people to do the job they want to do of providing high quality care. And it always amazes me, we have probably the most skilled and motivated workforce anywhere in industry in the NHS, and yet we manage them through command and control and hierarchy. It just doesn't make sense. And it kind of leads us into the next question here really is, for me, compassionate leadership is about listening with fascination to those that we lead, understanding the challenges they face, empathizing with them, and then helping them, as we've discussed. And this is a question from Adrian Descent, who's one of our Darcy Fellows. And the question he's asking is, the problem is with the workforce shortages we have, people are under such pressure. How do we find the time to listen? How do we find the time to really arrive at a shared understanding? How do we have the space to empathize? How do we find the time to help, especially when we don't know what to do? It's a tough question to drop on you, and so many of your questions are fantastic. Yeah.
Well, go ahead, Sam. Go ahead.
Well, I'll just shout out the Darcy Fellows. They are a fantastic group of people, and they fill me with optimism for the future. For me, it's teamwork, Michael, and learning from your research, actually, and going out and talking to people about actually get off the treadmill. It may feel really, really difficult. It may feel really tough, but taking planned team time out. And when I became chief executive in my trust, team days have sort of fallen by the wayside. Teams weren't taking time out regularly. We said we want every team across the organisation to take at least 2 days a year out. Hospitals, wards, everybody. They're doing that. Some of them are doing it every 12 weeks, and the research shows it supports productivity, it enhances satisfaction, it has a direct impact on patient care. I think some teams need support. Not all teams get there quickly. So again, as leaders, we need to make sure we've got really good support in place and recognise that it is difficult. And I think particularly if you get to the point where you can't see the wood for the trees, you do need to stop and ask for help and support.
Yeah. Thank you.
I was going to say, in an organisation, especially a large one in which the focus is on patients, we sometimes don't see each other. We just don't, and I mean see in the real sense of being seen as a human being. And actually it doesn't take time, because you can see someone by asking how you are and really listening to the answer. And I'm not saying I have this down pat or something, but it's something I remind myself. Like, I'll have a call with someone, a friend, and I'll notice that in 5 minutes we can really get to a good connection. We may not have spoken for a while. And so at work, if 5 minutes is going to lead to a good connection, then those 5 minutes are absolutely worth it. 5 minutes is nothing. So, kindness doesn't take time, and definitely seeing someone, it might feel like, there's no time to do that, but actually 2 minutes of really asking someone how they are and listening to the answer is so, I think it releases this energy that is so powerful. And, I want to ask people and I want to be asked back. And so it also makes this connection between the leader and team members and colleagues that sometimes, it feels quite separate. And then after the fifth time, you know how that person is and you can respond appropriately, but it really drives that connection. I mean, this would be one kind of practical, thing that I would share, is that I try to do is to really not be so transactional and just move directly, which I've done in the past, because I've felt the pressure, as we all do, of, I have to get this done and then I have these 5 minutes. And
back to Don's point about this transactional approach.
Absolutely.
Yeah. So, and for me, what you're saying is there's something about being really present in those interactions, and it reminds me about, we often talk about a leader as having presence, and what it means is that leader is present, and the other point is, we have some astonishing research now from a meta-analysis of 49 published peer-reviewed studies showing that teams take time out on a regular basis to review and reflect are on average 38% more productive. Don.
Yeah, the conversation reminds, there's an apocryphal story, I guess, about Abraham Lincoln, who more or less said, it takes me 10 minutes to saw down a tree, 1 minute to saw down the tree, 9 minutes to sharpen the saw. It's the question of what is efficiency, what is productivity, and this transactional stuff has got us driven crazy. And what Adrian's asking about is, how can I find the time to sharpen the saw, which is the relationship building. He may not be in a position to do that. It may take a leader to reserve the time. I had a surprising experience, not planned, when I took over the Centers for Medicare and Medicaid Services in the Obama administration. The president asked me to run this very large system, and I had 5,500 people. First day of work, what do I do? Well, it was a third day. I finally...
You know the feeling, eh, Prerna?
No, it was really something. So what I decided, against advice, was I'll have a meeting of everybody. We can do it virtually. 5,500 people. Slow down. Let's talk. But here's the surprise. My first slide, before I started talking about strategy and goals and all that, I just showed a photo of my family, of 4 children, my wife, 4 spouses of my children, and at that time a couple of grandkids. That's what I heard about. From then on, for the rest of my time there, he said, "Oh, I remember you showed your family." Was that work? Yeah, that was work. That was beginning to build, and I did. I wish I could say I planned it that way, but it was more valuable to establish that human bond than any slide of strategy that I showed that day.
So authenticity, presence, reflection as being key to addressing these issues. So we've got lots of amazing questions coming in. I'm going to pick up 3 now and tell you about them, and then you can pick, whichever your heart alights on. So.
Do we have a buzzer?
So Musmira Irvan, who's at NHS England and NHS Improvement, really raises the question that it's about how inclusive leadership can be enacted so that everybody feels that they are a leader within their organisation. How can we create that sense of inclusivity? And Tracy Graham talks about, we don't reward at the minute for compassionate leadership. We reward for budget control. And I guess just your reflections on that. And the other is, Brian Rocks talked about how does the regime of regulation and oversight by the arm's length bodies influence compassionate leadership? So those 3 questions there around how do we create more inclusive leadership? Do we reward more for budget control, and what about the role of the national bodies in the culture that they create? Who would like to start? Pick one.
I think it's a really interesting time, particularly around the national bodies. So the exciting time for the system I'm in has been the focus far more on relational aspects of leadership and starting to remove the commissioner-provider divide, actually. So we're not stuck in a cycle of victim and persecutor over a contract and a target. We're sat around the table as leaders, working together using our collective talents to think about how we can affect the change together. So that's really good. I'm curious, and I was interested in what you said earlier, Prerna, around colleagues asking you, how do we hold I interpreted that as, how do we hold a grip on the system so performance doesn't slide, and do that in a nice and a kind way? And I think that's a genuine challenge, and I'd really encourage our regulators and our system to come and talk to us openly about that and co-produce that together and own it together, because I genuinely think it's tough for them. So I think we can develop the solutions if we sit around the table and talk to each other. But to go back to the point that was made, there was a lovely quote in our Men as Allies report where a chief executive said, I'll get a phone call if the money's sliding, but nobody will ring me if I haven't addressed diversity or inclusion, or I've had an uncompassionate day. So I would say, let's not look upwards. Let's get around the table together and solve these things together.
Great, thank you. Prerna.
Well, let me just add on the piece about national bodies, and it's linked to regulatory, the regulatory behavior and what gets measured and tracked, etc. I think Sam's put it really, really well. What I can say is there's a lot of conversation going on at the national bodies about the impact of the leadership style from national bodies towards the rest of the system. So that's a very positive, hopeful sign. There's a real recognition that while there's a piece of the responsibility, which is regulatory, first of all, the way that has to be done needs to shift, and there's a real recognition and conversation about that. And then there's a whole piece which is much more about improvement and an improvement culture and an enabling culture than it is about kind of a policing culture, than that it's felt like that and been like that in the past. So all I can say is the discussions that are happening at the national executive team with the national directors and regional directors is very much about that, making that shift. So more collaboration, more getting around the table, as you said so well, Sam. So it's I think it's a good time to be involved with what gets measured. And then I'm going to put on my list, to call someone and say, so what's happening with inclusion, in your trust? Because that's really, if people are feeling that there's not enough, and it's true that there's not enough integration between operational results, quality and financial results, as well as people results, then we need to do a better job of that.
You talked about, you've all talked about the importance of humility in leadership, and that rather than heroism and hubris. And I guess there's something for the national bodies about having the humility to recognize that we need to interrogate our own cultures and leadership, because those will have a significant influence on the whole system. Don, would you like to add to that?
Sure. The two reactions to the questions, all three questions. One is the role of measurement. It's often said if you can't measure it, you can't manage it. Wrong. Absolutely wrong. And I hopefully have never said that or asserted it. We manage things all the time without metrics. You can't manage it if you don't understand it, if you can't learn about it. But that's very reductionist. And the question about budgets are reductionist, but that's their nature. But that's not excellence. And I think when you take that thinking into management, you've missed the point. And the other mistake, I think, is about extrinsic and intrinsic motivation. I don't know why we slip into the notion that we have to make people care or hold them accountable or feet to the fire. Have you not met people? Yes. They really want to do well. There's beauty in this. And so this question about the role of compassion, do you not understand that investing in compassion is the smartest move you can make for overall excellence? Because what that allows you to do is have people discover in themselves their own spirit, their own energy, the things they care about, and they'll bring the excellence to you.
We're hardwired to be kind and to love.
We are. Watch a child. Just watch a child.
Yeah.
And if you can evoke that or help support that, just nurture that, things will follow. Then you might measure some stuff, because we all might get better if we understood it. But driving instead of releasing is the basic mistake here. And it's very seductive, but it doesn't work.
Yeah.
Can I just add one more thing? Just in this short time that I've been here, I've already seen how process is a lot, let's just say. And sometimes it's, the outcome is kind of lost somewhere, and there's a lot of process. And there's something about that being quite the opposite of compassionate, because the process has no feelings and it doesn't take into account anything that's happening, and it has this autopilot nature. And that's how I'm experiencing it myself in this privileged role that I have. So I can't imagine how other people might be experiencing it, hopefully not worse or more strongly than I am. But if there is a choice, and I've already found myself in a position where it's a choice between people and process, and that's for me a real live choice between compassionate leadership and not compassionate leadership. And so choosing people over process is never the wrong decision. and I would just like others to help me do that in the work that we are going to do from the people function, but also support and protect me when I get into trouble for not following some of the processes. But really, I think that that's where some of the compassion, is expended, is actually in some of our processes.
And I think just picking up on the command and control piece, if you do command and control, it might get you so far once, but actually what you get is you get learnt helplessness, you get people waiting to be given permission rather than getting on with things. So when I think about the 10-year plan for the NHS, we need to find a way of just saying to people, get on with it, we're going to trust you, we're going to give you permission, get on with this. There will be some mistakes, we'll make some mistakes along the way, but the failure to do that will be we'll have lots of lovely spreadsheets, we'll have lots of lovely assurance meetings, and we'll tick a few boxes, but we will completely and utterly miss the point and the wonderful opportunity that we've got.
Yeah. Would it be naive to imagine the employee manual, which you open, it only says one thing, which is do the thing you know to be right? And
say that again, Don, please.
You open the employee manual and it says, do the thing you know to be right. And then if you can't, let me know, because my job is to help you do it. It's too much box ticking.
Yeah. There we go. That should be helpful. I mean, I think that it's right. We often end up in this. You described the complexity at the beginning. In this complexity, we often end up thinking that really smart intellectual cognitive processes that we go through will give us a design and an approach that will work, but actually has no bearing on the fact that we're managing people within these organizations. And as you say, Don, the kind of fundamental motivation of people is to do good and be kind and be helpful. All these people who work in the health services have made a decision to dedicate a huge part of their precious lives to helping those in their community. So you tie into that energy, and anything's possible.
The question was, Adrian asked about hierarchy. Yeah. I've always thought the inversion of hierarchy is the key here. You have the patient and family, and they need help, and then you have someone trying to help them, and that's the boss. And then every other tier, whatever you call them, whatever it is, your job is to help that occur. So it's not, the workforce doesn't serve the leadership. No, it's quite the other way around.
Yeah, the leadership serves the workforce.
Absolutely.
Yeah. So we've got a question here from Henriette and Bea Bankus, who's at Health Education England, and it's an interesting question, I guess, for all of you in terms of your experience. It's how can we learn from other sectors who do some or all of this well? And in terms of what you just said, not very far from where we're filming is a particular store, which is a large, very successful store where they have 80,000 employees and 3 layers of hierarchy. So, a question about how can we learn from other sectors. Prerna, I'm going to come to you because you spent time at Unilever, the World Food Programme for the UN. You've seen a lot of different organizations.
I'll share one, but I mean, many organizations do many different things. In the UN, one of the things that has made a difference, because the humanitarian world is really at the front line, people are in war zones and providing life-saving assistance, and it was seen to be, although it's a service role and life-saving role, it was seen to be a macho cowboy kind of role. So you're in a war zone, the only thing is you're not armed, but you're doing pretty much some of the work that, military might do, and you're going into areas where you're putting your life at risk, and people actually lost their lives in the service of saving others. And most of those jobs, and then they found that the internal culture is really very difficult, and it isn't compassionate. So there's compassion for the beneficiary, as it's called, but not compassion for the teams. And one of the changes was actually putting more women leaders in roles where they thought, well, how can a woman lead, this food distribution and assistance program in Iraq while the war is on, or in Syria? One of my closest friends in WFP now heads the operation in Syria. And research has also shown that there is a difference in leadership style, both conditioned and I won't get into nature nurture, but that there's a more caring relational style that women have. Not all women and not all men, just let me give that caveat, that's not what I'm saying, but in general, the research shows that women take into account the impact of their decisions on others, and men take into account impact of their decisions on processes, or let's say financial outcomes. And that's not a value judgment, that's just what research is saying. So when we have 77% of the NHS workforce as women, what are some of the roles that have been a little bit closed to that profile of people who are taking decisions based on impact on others, that we can make a difference with. So coming back to the question, sorry, I've taken a bit of a digression, in the UN and in the humanitarian sector, the shift in having women in those roles has really shifted the level of compassion and care in those cultures.
Thank you. Don.
I believe that. I think that what Prerna said earlier about the heroic view of leading is really it's a mistake. And I think this, dare I call it, nurturant view of leading, or is crucial. I believe those data.
And there's something about, for me, recognizing as well what the fundamental needs are of people at work. And what we understand is there's a need to belong, to feel valued, respected, and supported in a team, in an organization, to feel a sense of growing competence rather than being overwhelmed, for example, by an excessive workload, and a need to have a sense of control and autonomy, not being independent of others, but to have control over our work environment. And I think that's what you've been saying, is about the need for compassionate and inclusive leadership to reinforce or to meet the needs that people have in the workplace. We've got there's two. I'm going to ask you two questions because time is short. This one's from Vicky Ackers, and she says, when the system is broken, how do leaders and the workforce rebuild the trust between each other? That's the tough question. And the other tough question is, how can humour help in creating a supportive, compassionate leadership culture?
I think humour definitely can help, because it's human, isn't it? As long as it's appropriate. I don't always get that right, but I do enjoy laughing, and I smile a lot. Just thinking about connectedness, and I digress slightly, because I was thinking when you were talking, Michael, back in our trust, we've got a lot of colleagues bringing their dogs to work. So we've got fabulous Muttley Moss, who comes to work with one of our psychiatrists on a psychiatric intensive care unit. And simply by having Muttley with his human, Dr. Moss, every day, Muttley has reduced the use of seclusion by 75%. And also, so he's not only benefiting the patient, but colleagues love Muttley, and we've got lots of animals coming to work now, and we're going to be doing a piece of work later this year on animal assisted therapy. But there's something again about thinking about the connectedness to not just our colleagues, but the things we hold dear to us. So again, encouraging sort of environments where we can allow that to happen, I think is hugely important. The tough question around
Re-establishing
when
trust,
the system is broken, courage again, and humility, openness, and the start of dialogue. I think through an appreciative inquiry lens. So trying as best we can to move away from the deficits of what's wrong to encouraging people to shape a vision of how things can flourish and what their role can be within that. And tenacity and persistence, it's not a quick fix.
Yeah, this is about promoting the health and well-being of people and communities so that their experience of life is as wonderful as it can be, and that's the shared vision we have. Don?
To the first question about how to change, I guess it's the same answer, which is ask. I mean, just ask. If as a leader you've come to think it's not quite right now, lower your guard, express your own uncertainties, and ask for help. I think if it's authentic and you keep at it, I think the workforce will help and you can change direction, but you have to mean it, and they're going to be they're going to be testing you about whether you're really serious. The role of humor, that's a very interesting question. Yes, let me link that to celebration. Let's have time for celebration. That's important.
I'll just add for the trustworthy or increasing trust, there's worldwide trust in institutions is at an all-time low. So we are not exempt from that in the NHS. And the question would be, how can we overturn a global phenomenon of reducing trust in institutions? And that's because people don't see institutions as serving their needs and being open and honest about it or consistent. And all of this is very hard, as any parent will know, to be consistent in what you say and then follow it up with action. And for me, the word that comes up most for me, along with trust in institutions or amongst people in an institution, is transparency. So I don't think there should be any decision that affects people happening behind any closed doors. There should be no information that's not accessible to people who are going to be impacted by it or are interested in it. And there should be this kind of paternalistic, like, well, I'm going to decide and then let you know when the time is right. And so for me, transparency is at the heart of everything. Let's webcast our meetings, and then you'll see how boring they are. There's humor. I tried.
There's the humor. Yeah. So our time is sadly up. I would like to say a huge thank you to Prerna and to Sam and to Don. It's been an amazing privilege for me to be involved in this conversation. Part of the time I forgot you were there, I have to say. It's been an amazing privilege. So thank you to you for joining us, and thank you to these wonderful, inspiring people. I feel that our NHS is in good hands going forward, and we desperately need a lot of help to get this right. I want to finish by saying something that Prerna talked about earlier on, is that beginning, in order to be compassionate as a leader, it's really important that we begin with self-compassion, and that means paying attention to ourselves and understanding the challenges that we face in our work lives and indeed in our lives generally, and that it's important to empathize with ourselves, to care for ourselves, and to take intelligent action in order that we can be our best selves and stay close to the core values that give our lives meaning, like compassion, as you were saying, and wisdom and gratitude and wonder. And in that way, we're able to have deeper and more authentic connections with everyone we lead, indeed everyone we interact with. So thank you for being part of this. And the program, the webcast, will be available on demand in the next couple of days. And do let your colleagues know that they can access these resources. But it begins with self-compassion. Thank you for joining us.